For more than 40 years, one group of drugs has been considered untouchable in heart care: beta blockers. Doctors prescribe them to nearly every heart attack survivor almost automatically. The belief was simple: they protect the heart, reduce risk, and save lives. But now, the largest trial ever done on this topic has revealed something shocking. For many seniors, especially women, beta blockers may not just be useless, they may actually be harmful. The study is called the REBOOT trial. Researchers followed more than 8,500 patients across Spain and Italy, tracking them for nearly 4 years. All of the patients had suffered a heart attack but still had normal heart function. Traditionally, that group would go home with a prescription for beta blockers. But what did the study show? No benefit at all. Seniors on beta blockers had the same rate of death, new heart attacks, or heart failure as those who took nothing. Even more concerning was what researchers found when they looked closer at women. Older women who took beta blockers after a heart attack were actually more likely to die, suffer another attack, or end up in the hospital for heart failure compared to women who did not take them. That risk was not seen in men. Why does this matter so much? Because more than 80% of patients worldwide are still prescribed these drugs after an uncomplicated heart attack. Millions of seniors are taking them daily, assuming they are essential. Yet, for people with normal heart function, the evidence now shows they may add no protection and, in some cases, extra danger. So how did we get here? Why were beta blockers considered life-saving for decades? And what's changed? That's what we'll explore in the next part. To understand why this discovery is so important, we need to look back. Beta blockers became standard care in the 1970s and 80s. At that time, heart attack treatment was very different. Blocked arteries often stayed blocked, arrhythmias were common, and the risk of sudden death was high. Beta blockers reduced the heart's oxygen demand and stabilized rhythm. Back then, they truly saved lives. But medicine has changed. Today, when someone has a heart attack, arteries are reopened quickly, stents are placed, and blood flow is restored. The extent of damage is often much smaller than in the past. Modern drugs, statins, ACE inhibitors, blood thinners already reduce complications. In this new reality, the old benefit of beta blockers has faded. And yet, the side effects remain. Seniors who take beta blockers often report fatigue, low energy, dizziness, depression, even sexual dysfunction. For someone trying to stay active and independent after 60, these effects can be devastating. The REBOOT trial proved what many doctors suspected but couldn't prove until now. For patients with normal heart function after a heart attack, beta blockers don't improve survival. In fact, for women, the risks are higher. The study showed women had a 2.7% higher absolute risk of dying or being hospitalized for heart failure, compared to those who skipped beta blockers. That is not a small number, it's thousands of lives if applied worldwide. Think about that. For decades, millions of seniors were told, this pill will protect you. But for many, it may have been draining energy, lowering quality of life, and in women, quietly increasing risk. So what should seniors do now? Does this mean stop taking beta blockers immediately? Absolutely not. In the final part, we'll break down what steps to take, what safer options exist today, and how to talk to your doctor about your medication plan. So what should seniors actually do with this new information? The first and most important rule is simple: don't stop your medication on your own. Beta blockers are powerful drugs that affect your heart rhythm and blood pressure. Suddenly quitting them can cause dangerous spikes or arrhythmias. If you are currently taking a beta blocker, keep taking it until you have an informed conversation with your cardiologist. Here's what that conversation should include. Ask whether you truly need the drug based on your heart function today. The REBOOT trial only showed no benefit in patients with normal heart function after a heart attack. If your heart function is reduced, the medication may still help you. If you are a woman with preserved heart function, discuss the new findings carefully. The data show your risk may be higher if you continue long-term. Your doctor may have alternatives or may choose to taper you off safely. Don't forget to mention side effects. Many seniors live with fatigue, dizziness, or brain fog and never realize their beta blocker could be the cause. If these symptoms match your daily experience, tell your doctor. There are often better options. Now let's talk about alternatives. Modern heart care doesn't rely on one single drug. In fact, studies like SECURE and Depitavi have shown that other strategies can dramatically improve outcomes. The polypill, a single pill combining aspirin, ramipril, and a statin reduced heart events by 33% in one major trial. SGLT2 inhibitors, originally diabetes drugs, they now show benefits for heart patients, improving survival and reducing hospitalizations. Lifestyle medicine, cardiac rehab, regular walking, strength training, and a heart-healthy diet rich in vegetables, fiber, and healthy fats are still the foundation. These steps don't replace medication, but they often reduce the need for higher doses or extra drugs. This is the real takeaway. Medicine evolves. What worked in 1980 may not be what's best in 2025. For seniors, that means you need to stay informed and proactive. Doctors are updating guidelines, but it takes time. You can speed up that process in your own care by asking questions and demanding clarity. Let's recap. For decades, beta blockers were routine after a heart attack. The REBOOT trial proved no benefit for seniors with normal heart function. Women in particular faced higher risks of death and complications. Side effects like fatigue and dizziness remain common and harmful to quality of life. The solution is not panic or quitting cold turkey, it's a conversation. Ask your doctor, do I really need this pill? Is there a better option for me now? Remember, seniors deserve treatments that heal, not harm. Medicines are not timeless truths, they are tools. And sometimes it's time to put down the old tool and use a better one. So I'll leave you with a question. Are you or someone you love still taking a beta blocker every day? What has your experience been? Has it helped or has it drained your energy? Share your story in the comments. Your words might help another senior watching this video right now. And don't miss our next video, where we'll uncover another surprising health habit, one that many seniors think is safe, but may actually be silently stressing the heart. Stay informed, stay strong, and as always, take care of your heart.